Welcome back in. A very important conversation we're having. I'm so excited about this. I'm joined by Dr. Meg Heusser, a Mobile native OB-GYN with Infirmary Health's Mobile Bay OB-GYN Center. She's an advocate for educating potential and expecting mothers about pregnancy and postpartum. All of that is so important, of course, and you've been chronicling this all on an Instagram account recently. That's your latest adventure, right?
Yes, I have been.
So a lot goes on when you are pregnant. You're also a doctor. And then you've got this Instagram account that I just checked out, I was telling you about earlier. You're doing a whole lot, and it's all for a great purpose, just to educate others, right?
All for education, for empowering women to understand the normal changes that our bodies go through during pregnancy, being able to recognize normal from abnormal, and kind of just seeing how I, as an OB-GYN, navigate through the healthcare system and go through these same challenges that we all go through.
Why is this so important, really, education for women, right?
Education is huge. There's so much information out there now, which is great. We have so much information at our fingertips available on the internet, but there's a lot of misinformation too. So the value of good quality maternal education has been shown to decrease maternal and neonatal morbidity and mortality, helps to improve pregnancy outcomes. We've seen that with formal community education programs like the childbirth and delivery classes, the breastfeeding groups that are offered at the Mobile Infirmary, and other hospitals. So this is kind of an adjunct way to reach the people who are looking for other sources of information on social media.
Yeah, because, you know, sometimes we get in trouble by our doctors, like stay off of Google and social media, because you can see a little bit of everything out there, but hearing from a doctor and is going through it themselves, that's got to be a unique and a great perspective to see. So talk about a little bit about what you've been posting, some specific posts on your Instagram.
Sure. Well, recently I got my Tdap vaccine, so talked about vaccines, why Tdap is so important in pregnancy to prevent pertussis, or the whooping cough, in neonates. So I kind of documented that. I showed the struggle of drinking the glucose drink. I can totally commiserate with that.
Yes.
I've had a lot of nausea this pregnancy, and it is really kind of a rough experience to go through that, but I did it. I recognize the importance of it, and want to show some solidarity.
Yeah.
It's an important test, and I believe in it, and so.
It is. And as just having a child myself in September, I am all like advocacy for all of this postpartum too, including.
Absolutely.
There's so much that goes into it that people don't know about until you're going through it, really. So.
Absolutely. And I really want to normalize that conversation and bring that into the forefront. We should be talking about it more, some of the normal kind of challenges that we go through in pregnancy and postpartum.
Yeah, and talk about, before we let you go, infirmary health and just any kind of classes that folks can get involved in, or women can get involved in if they're pregnant. Absolutely.
We have so many different opportunities for childbirth education, for labor and delivery classes, tours of labor and delivery. There are breastfeeding support groups where you can meet in person, bring your baby, kind of go through some of the challenges that we face in trying to feed our children. So a lot of support all available at the infirmary website, infirmaryhealth.org.
All right, infirmaryhealth.org is that website. Your Instagram handle is Dr.Meg_does_pregnancy, right?
That's right, Dr. Meg Does Pregnancy.
Awesome, so you can look it up there for more information. Thank you so much for being here with us today.
Thanks for having me, Shelby.
Of course, we wish you all the best of luck with your new baby on the way.